Hi, I'm Dr. Ryan Goodkin, and today we're going to talk about the pillars of health. We've identified stress, sleep, socialization, nutritional biochemistry, exercise physiology, and exogenous substances. Those are just things that we take from the outside and put in our body. We're going to focus on a subcategory within the exogenous substances. I consider those to be drugs and really dietary supplements. Let's talk about drugs because lately I've gotten a lot of questions about what is the impact of a certain medication? Drug interactions, side effects. What are these drugs and how do they interact with our body? People are becoming more aware and we're getting more questions. And so we're just going to talk about a couple of the high-level ones. The numbers are just staggering. When you look at medications dispensed, 50 million prescriptions a year are for a diuretic. 45 million prescriptions a year are for a proton pump inhibitor, which shuts down the acid pump of the stomach. I'm trying to treat usually GERD, right? It's just heartburn, reflux. I mean, these numbers are crazy, but the impact of these medications is huge. So, for instance, the diuretics. Common diuretic, hydrochlorothiazide, depletes the body of magnesium and potassium. Causes the kidneys to excrete. So when we start looking at and talking about all the different pillars of health and how the circuitry is all combined and why nutrition is so important, and why dietary supplements are so important, and how to optimize our performance and our well-being, we have no choice but to confront and identify the drug category. You've heard me talk about this in the past because I can really go off on it and stand on a soapbox and just think, drugs are introduced at such an early stage and they shouldn't be introduced so early, but you know what? It is what it is. And if you're on these medications, I just want you to be aware. And when you're adding in and talking about the pillars of health and you start thinking about ways to optimize your health, you're going to want to supplement those back in. And that's not going to impact the medication in any way. It's not going to affect you. Obviously, I'm not suggesting that you discontinue your medication. That is not what I'm saying. But certainly consider the cause and effect of some of these medications. Another one is a proton pump inhibitor. That's also known as Prilosec. It's used to treat GERD, otherwise known as reflux or heartburn. And so this medication is essentially shutting down the proton pump, or the pump that's creating the acid at the stomach. Well, unfortunately, cause and effect, that stomach acid is needed. It's needed to absorb iron. It's needed to absorb calcium. So those are other two things to think about. And that prescription alone, I think that medication alone is spent 45 million prescriptions annually. So when it comes to drugs, always, always, always ask your pharmacist. Speak with them. Speak to your physician, the ordering physician. Talk to them, see what side effects, what cause and effect is there when I take this medication. It's so important, especially if you're trying to optimize your body. And we'll talk a little bit, you'll hear me, I love magnesium, I love vitamin D. So these are some things that we're going to really dive into at a later time. So I'm Dr. Ryan Goodkin. As always, I welcome your comments and questions below. Also, please don't forget, like and subscribe to this channel and follow me on social @RyanLiveGood. Thank you and be well.